Today we're talking about the ankle sprain, and 23,000 ankle sprains occur each day in the United States alone. And that factor or that number is probably kind of on the low end because not everyone goes to emergency room departments and hospitals and things like that when they get an ankle sprain. A lot of people sprain their ankle, they wait around a couple of days, maybe rest and ice it, and then they get back to their normal activities. And we're going to talk about some of the pros and cons of different strategies for ankle rehabilitation today, because the likelihood that you, the listener, has probably already sustained an ankle sprain is pretty high. That's probably why you clicked on this episode. So welcome, and hopefully I can help you out today with some injury prevention for your next ankle sprain. So 23,000 of these occur each day. That's probably on the low end. The way that we most commonly sprain the ankle is through what's called an inversion ankle sprain. So this is when the foot twists inwards. So if you just have your feet planted on the floor, you just raise up your big toe off the ground and raise up the inside of your foot off the ground, and you'll feel a little bit of a stretch on the outside of your foot. That is a basic way of looking at inversion in the ankle. And that stretch that you're feeling is a stretch of the lateral restraints of the ankle. And we have a couple of different lateral restraints. We have active stabilizing structures and we have passive stability structures. The passive stability structures include the ligaments and other non-contractile connective tissues of the ankle. The most commonly injured ligaments here include the anterior talofibular ligament. So that's the most commonly torn ligament in the human body. Also the calcaneofibular ligament and a few other ligaments that are on the outside aspect of the ankle. Now, as far as contractile or active stabilizing structures here, we have the tendons of fibularis longus and fibularis brevis, a little bit of fibularis tertius, and in a way, the Achilles also can help us from inverting the ankle too much, but really the big ones are the muscles that I just spoke about, the fibularis longus and fibularis brevis. So there are a couple of different grades to an ankle sprain. A grade 1 is significant stretching to the tendons of those muscles and to the ligaments that we just discussed. A grade 2 would be partial tearing of those ligaments and maybe even a little bit of extra stretch to those tendons. Now, a grade 3 ankle sprain, kind of uncommon because the ankle basically dislocates and then relocates, or hopefully relocates. In a grade 3 ankle sprain, we have a blowout of all of those ligaments, so the ATFL, the CFL, and all the other lateral restraints of the ankle. This one is typically managed with some surgical interventions sometimes, depending on which surgeon you go to. And this is kind of beyond the scope of what we're going to be talking about today. Today, we're going to be talking more about the management and prevention of recurrence for grade 1 and grade 2 ankle sprains. So mild stretch to a little bit of tearing of those lateral restraints. The reason that we want to prevent ankle sprain recurrence is that this is a much more nefarious process than we give it credit for. So one, your susceptibility towards an ankle sprain really goes up with an ankle sprain, especially ones of the higher variety, grade 2 and grade 3. And when we have ankle sprain recurrence over time, we then put you in the new category of classification as having chronic over time ankle instability. So these are the individuals that, I sprain my ankle a couple of times a year, and now there could be a pebble on the ground, and if I hit it wrong, then I'm spraining my ankle. It's totally going out. And this is all too common of a phenomenon. And unfortunately, chronic ankle instability, CAI, the susceptibility for ankle arthritis really goes up in individuals that have chronic ankle instability. Because if we're chronically dislocating or spraining the ankle, we're also going to damage some of the osseous and cartilaginous structures of the ankle. So things like the talar dome and other cartilage surfaces of the ankle. And the thing about cartilage is chondrocytes and cartilage don't get really great blood supply and thus have a very low regenerative capacity. And that's what leads to osteoarthritis over time. Now, there are ways that we can stave off osteoarthritis. One of the biggest ways is remaining active so that our body keeps producing synovial fluid and we keep muscular strength around the ankle. And this helps us to preserve a lot of that cushioning structure, such as the hyaline cartilage around the ankle. So this is why it's so important that, especially after an ankle sprain, we prevent the future recurrences of ankle sprains, thus preventing CAI, thus preventing osteoarthritis. So if you have an ankle sprain, the last thing we actually want to do is what's called the RICE protocol. That's rest, ice, compression, and elevation. So if we look at a consortium and expert agreement on the topic of ankle sprain and ankle sprain prevention in the future, they actually looked at comparative analyses in studies looking at ankle sprains that were treated with improvements in return to function and return to activity very quickly, based on symptoms and based on some of the structures that were damaged, versus solely rest, ice, compression, and elevation. And what they found was that there was no extra benefit to rest, ice, compression, and elevation. So no extra benefit to RICE. So what this means is that we really want to get people back to activities as quickly as possible. Now, if you're experiencing an ankle sprain, in order to get back to activities as soon as possible, this can really be facilitated by a licensed medical professional, whether that be a physical therapist, a sports chiropractor, or any other person of the like. And these people can really diagnose the grade of your injury and bring you back to activities in your sports in a stepwise fashion. So if you're someone that's dealing with recurrent ankle sprains and things like that, yeah, you can use the information from this podcast, but this is really not medical advice and we are not treating your ankle sprain. So seek the advice of a professional if you're dealing with an ankle sprain, and it'll get you back to better than before, hopefully. Now, if you're a coach and you've got an athlete that is recurrently or chronically spraining their ankle, one of the things that's been shown to be effective is actually utilization of a functional ankle brace. So in some ways, there are a lot of pros to ankle bracing strategies and ankle taping, and in some ways there are a couple of cons. So some of the pros that we see with ankle like functional braces, we don't want to do complete immobilization. We want to do functional bracing or ankle taping. And what this does is it provides a little bit of extra support to the ankle and those lateral restraints so that we can take some of the load off of the outside of the ankle. Now, this is really good and has been shown time and time again in literature, which we'll publish in the show notes, to prevent the recurrence of an ankle sprain. So especially when we're looking at the kind of coming back to activity, or within the first 3 to 6 months after a really bad ankle sprain, it would be beneficial to, one, use a functional brace or tape the ankle, and even kinesio tape, believe it or not, has been shown to benefit ankle sprain populations because of postural effects that taping has on the tonic muscle tone in the active restraints on the outside of the ankle. And we'll put in some of those studies in the show notes. So bracing is one way that we can decrease the risk of recurrence. However, there aren't necessarily studies that show this, but when we have lack of mobility and immobilization in one area of the body, we then take up that mobility in other areas. So the classic example would be skiing. We don't necessarily see a ton of ankle sprains in skiers. Why? Because the ankle is largely immobilized in a plastic boot. What do we see a ton of though? We see high rates of ACL injury, we see high rates of MCL injury, we see high rates of knee injury and hip injury, low back injury, etc. And that's because we're taking up that mobility in other joints of the body up the kinetic chain. This happens to a smaller degree when we utilize functional braces, but this is still occurring. So there are pros and cons with each one of the tactics that we utilize in order to try and prevent the recurrence of future ankle sprains. So in the short term, functional ankle bracing can be beneficial, and especially if you're someone who really has that chronic ankle instability, it might be beneficial to either tape or brace consistently so that we don't recurrently sprain the ankle. Now, one of the other ways in which we can prevent the recurrence of ankle sprains that everyone, regardless of taping or bracing, needs to employ is something called neuromuscular training. So neuromuscular training is an umbrella term for many, many different types of training for the ankle. And indeed, in the literature, neuromuscular training has covered the vast array of exercises that go from balance training, coordination training, to even plyometric training. So now we're going to take some time to dive into some of the different ways that we can work on neuromuscular training so that we can decrease the recurrence of ankle sprains. Now, one of the easiest ways that we can work on the neuromuscular control of the ankle is actually to work on balance after an ankle sprain or before an ankle sprain. So here's a fun test that you can do at home. Hopefully, if you're driving, you're not going to do this right now, but maybe once you stop driving, what you can do is just stand on one leg. So how easy is that? Standing on one leg, eyes open. When we're standing on one leg or even two legs with our eyes open, we have three different systems that are keeping us upright and balanced in the gravitational plane. We have our visual system, which we human beings utilize primarily to give us reference points and data on if our body's swaying from side to side or if we're falling over. Now, the visual system works in conjunction with our vestibular system, i.e. the system within our inner ear that tells us whether we're sliding side to side. This is the system that we really play with when we're on roller coasters, or if we're spinning in a spinny chair, or if we're doing a backflip, etc. This system also works in conjunction with the third and final system that keeps us upright and balanced, which is our proprioceptive system. This is the system that utilizes information from what are called mechanoreceptors in our joints, tendons, ligaments, and muscles of our musculoskeletal system. So our body and our central nervous system takes the information from these peripheral receptors located within those structures to tell us, are we swaying side to side? And it really gives us information on if our muscles are being stretched and how much tension is in those muscles tonically and during activities. Now, after an injury, the proprioceptive system is the one that experiences the brunt of that injury. So if you sprain your ankle, you're not really affecting your visual system, you're not truly affecting your vestibular system, but you are having a big effect on your proprioceptive system. And that's the ability for your brain to control and recognize your joint positioning. So whether you're in an inverted position or an everted position of the ankle, and also how much tension and tone and tightness is in those connective tissue structures, whether they're passive connective tissue structures or active connective tissue structures. And indeed, we need to focus and prioritize the training of our proprioceptive system as we think about decreasing the rate of recurrence in ankle sprains. So how can we do that when we're doing balance training? Well, one, if you can't stand on one leg with your eyes open, you probably need to work there. Then, once you've mastered standing on one leg with your eyes open, what we can do is we can increase the difficulty of that exercise. And there are a couple of different ways in which we can stress our balance and a couple of different ways in which we can train each of those individual systems. There are two broad categorizations for training balance, and one of them is on training unstable surfaces, and the other is training with stable surfaces, and we can perturb the body, we can kind of give somebody a little nudge, we can have them focus on distant objects, or we can remove some of the other systems that previously have helped us stay upright in the gravitational plane. Now, training on unstable surfaces can be beneficial. However, if we look at comparative analyses in studies looking at training on unstable surfaces versus stable surfaces, what we see is that we can get benefits and we can get back to normalcy and we can prevent recurrence of ankle sprains utilizing unstable surfaces and stable surfaces. So no, you don't necessarily need to go out and get a wobble board in order to prevent recurrence of ankle sprains. If you have some readily available to you at your home or in your gym or in your athletic training room, then yes, I think that they're a great way to challenge the proprioceptive system, to challenge those mechanoreceptors and our reaction time associated with unstable surfaces. However, if our athletic endeavors don't necessarily occur on unstable surfaces, then we don't always need to train on unstable surfaces to get the benefits of balance training. So let's say you're at home and you don't necessarily have those unstable surfaces necessary to do unstable balance training. Now we can focus on training on a stable surface, but we can alter some of those other systems that we have available. So you've mastered the art of standing on one leg. Now, can you throw in some perturbations? Can someone toss you a ball and then you toss it back? So while you're focusing on that ball and not necessarily focusing on stabilizing in the ankle, are you able to do that without falling over? Next, we can alter, so that's an alteration of focus. Next, we can alter the other systems. So a good way to stress the proprioceptive system is to actually take out our visual system. So with this one, make sure that you have a stable surface or a door frame so that if you are falling over, then you can catch yourself very easily and very safely. And again, don't do any of these things without consulting a medical provider and things along those lines. So standing on one leg and then shut the eyes. And if we do this, we now take out the visual system, relying only on the inner ear system and that proprioceptive system. What you'll find is that this is much more difficult than standing with the eyes open. Oftentimes, especially after an ankle sprain, the proprioceptive system can be injured, and thus we have to reintegrate how our ankle functions and how we perceive information from our proprioceptors in the ankle and integrate those with the other two systems. Next, what you can do is you can stand on one leg. Let's do eyes open, and then shift your gaze and rotate your head side to side or up and down in circles, etc. And this challenges us not only from the visual standpoint, but also from the inner ear and vestibular system standpoint as well. So when we're working on balance, we have to take into account that we have three different systems that we're working on. We have the proprioceptive system, which is the most commonly damaged. We also have the visual system, which we most commonly use or we highly use in proportion to the other systems. So we can more stress the proprioceptive system by shutting the eyes and thus taking out the visual system. And we also have the inner ear system, which we can challenge by rotation as well as flexion and extension of the head. So moving the head back and forth, side to side, and up and down. Now, the next aspect of neuromuscular training would be neuromuscular coordination. So coordination is how we move and how we accomplish movement. So changing movement can always be a little bit difficult because we move and many of our movements are largely subconscious. So we have subconscious mechanisms that coordinate our movements. However, over time, we can slowly change how we subconsciously move with conscious thought. But we have to habituate these patterns. So one thing that could be important would be something like a soft landing when we're jumping or running. So if you jump down from something like a chair or a 6-inch box or something like that, if it always sounds like an elephant's landing on the floor, then some coordination training may be very beneficial for you. Because whenever we land very hard like that, we're utilizing our passive connective tissue structures and we're putting a lot of peak force through our active structures and through some of the osseous and passive structures. So one thing that you can do is jump down, see how loud that jump down is, and then try to land very softly. beginning with a landing on the forefoot and then rocking through to the midfoot and then the heel. And what'll happen is when we do those soft landings, it'll decrease the peak force that goes through those structures, and it'll level out the force that those structures experience. The next thing, which I'm going to place under coordination training, is actually strength training. So whenever we're thinking about strength is really the ability for us to increase tensile loading in our active connective tissue structures, i.e. our musculature, in order to produce force in the levers of our musculoskeletal system, i.e. the bones. So we create tensile force in the muscles so that we can then push the bones or pull the bones in order to place force, in this case, through the ankle. Now, our ability to create muscular force and tension is regulated by our central nervous system. And the way that it's regulated and the way that we increase force is by increasing in the recruitment of what are called motor units. A motor unit is defined by the motor neuron, i.e. the nerve that's going specifically to the muscle, and the units of that muscle, the individual muscle fibers, and all the muscle fibers that neuron innervates. So the motor unit is the motor neuron and all of its fibers. We have varying sizes of motor neurons, and we have varying sizes of motor units. And if we increase recruitment of motor units, we increase tensile pull, thus increasing force placed upon objects. So that's why I say this is coordination training, because we're coordinating the activity of motor units. And when we better coordinate our motor units, we can better produce force and we can better accept and utilize load, thus decreasing our susceptibility for injury. So a good rehabilitation program and a good decrease of recurrence program, we could call it, would be strength training for those active lateral restraints. So things like calf raises, things like a wide stance calf raise, which is going to put more force and more proportionate activity in those fibularis longus and fibularis brevis muscles, can be very beneficial as we reintegrate strength and re-coordinate strength through a previously injured or even a non-injured ankle. So strength training is very important, whether that be through heavy calf raises, like I said, the split stance calf raise, a bent knee calf raise so that we can strengthen some of the shorter muscles of the ankle, and even things like deadlifts, squats, Bulgarian split squats, etc., where we're loading and putting more force through the entire foot and ankle joint complex, or doing this unilaterally in something like a Bulgarian split squat with weight. All of these things can be beneficial for improving the coordination, and then the end result is an increase in strength as we recruit more motor units. Now, the next topic is perhaps one of the most important topics when we're talking about return to play and decreasing the recurrence of ankle sprains. And that topic is plyometrics. So plyometrics are dynamic activities, and we reintegrate dynamic activities in a stepwise fashion so that we aren't making us more susceptible to injury during a rehabilitation process. So this is where guidance can come into play from either a medical professional or a strength and conditioning specialist, or even your coach, as we bring you back to normal functioning and hopefully even improved functioning of the ankle. And we're going to dive into plyometrics now. We're going to divide it into two broad categories. We're going to talk about jumps and agility training. So jump training can be very beneficial because we're going to really increase the amount of force that's brought through the ankle joint complex. Now, even if we think of something fairly innocuous like running, running is basically a bunch of single leg bounds put together in an alternating fashion. And the amount of force that goes through the foot and ankle joint complex during running is up to 8 times our body weight. So running is literally a plyometric activity, and the amount of force that goes through our foot and ankle much exceeds what we normally think of when we think of just running as an activity or as a sport. So when we're jumping, it's better to start with double leg jumps so that we can split the amount of force, hopefully 50-50. But whenever we're coming back from an ankle sprain or an ankle injury, if we look at a force plate analysis, oftentimes we'll asymmetrically load, which is why eventually we want to progress to single leg jumping and loading. But initially, we could do something as simple as jumping or hopping down from a box or hopping up on top of a small box and then progressing the height of that box until we're very comfortable with those jumping activities. And then we can do the same thing with single leg jumping activities. Now, the way that we want to initiate jumping activities is in one plane of motion. So really just jumping in one direction. First, jumping up and down, so an axial jumping. Then we could jump forwards. Then we can work on jumping side to side. Like I said, we want to begin jumping in a double leg fashion. So whenever you're going from maybe jumping straight up and down to jumping in a different direction, it's always beneficial to return to double leg jumping before we progress in single leg while adding different variables. It's always good to change one variable at a time as we improve and get back to activities in that nice stepwise and controlled fashion. So once we feel comfortable with jumping in single planes of direction, we can then add in multiple planes of direction. So we can jump and then rotate to face a different object. We can jump on top of a box and then down on the other side of a box, etc. So reincorporating multiple planes of motion and movement with our jump training can be beneficial. And this is very important because athletics and athletic endeavors are multivariate in nature. And we have to be able to consciously focus on different aspects of the sporting environment, i.e., where is the ball? Where is the position of other players? Where are we trying to go? What kind of strategic involvements do we have, and what things do we have to focus on in the game? We don't necessarily want to have to focus on the stability of our ankle when we're in a gameplay environment. So when we're in practice and when we're in our rehabilitation / strength training for the ankle and our plyometric training for the ankle, we want to try and slowly introduce as many variables as possible in order to really prepare and lay down a great foundation so that we can play without thinking about the ankle. So double leg jumping and then progressing to single leg jumping and then adding in various variables associated with more gameplay style mechanics, such as jumping in multiple planes of movement, whether that plane be side to side, forward, backwards, or rotational planes, as well as in vertical height or depth. The next aspect of plyometric training would be agility training. These are your classic cone drills, ladder drills, etc. And beginning in a load management style, so decreasing the amount of speed or velocity associated with cone and agility drills is going to be very important because we obviously don't want to sprain someone's ankle during rehabilitation and during the getting back to normal performance. So agility training and those cone and ladder drills can also be very important. And it's important to also incorporate the element of surprise. So before an individual returns to play, you need to have a coach or a teammate perform agility drills or jumping drills and have them react to new scenarios and new environments. So they need to be able to react in time. So while they're performing those agility drills, there should be a reactivity component associated as far as, well, do you need to jump to the left? Do you need to jump to the right, etc., in order to put them in the mindset of you're focusing more on the movement and you're focusing more on the goal, i.e. moving towards the ball or moving in a new direction that you were not expecting, rather than focusing on the ankle specifically. So begin with, knowing the drill, knowing exactly what you're going to do, and focusing on that ankle and its stability, making sure that you don't overreach and go too far with your ankle rehabilitation, but then incorporating the element of surprise. So there is a priority for plyometric training. And if we look at comparative analyses, looking at just balance training or just end range plyometric training, plyometric training has been shown to decrease the recurrence of ankle sprains, which is really the end goal of our rehabilitation process and also the end goal of our preventative strategy. So balance training is very important. However, we actually get a lot of balance training in with our plyometric training. So hopping on one leg and testing that out is a form of balance training. Now, there are some benefits that we can get from specific types of balance training, such as our improvements in reactivity and reaction with unstable balance training. However, like we said, if we look at comparative analyses of unstable balance training with stable balance training, both of them really benefit the athlete, and both of us can benefit us in basically equivalent fashions. So when we're looking at neuromuscular training, it's important to go through the stages. So starting out with low force, maybe improving strength with low acceleratory movements, and then eventually making sure that we get to plyometric training before we return to play. When we look at preventing the recurrence of ankle sprains or preventing a first ankle sprain, we can utilize a couple of the different tools that we talked about, ranging from bracing to neuromuscular training and all of the facets underneath the umbrella term of neuromuscular training, such as balance training, coordination training, and plyometric and dynamic training. So I hope and encourage you to utilize all of the different things that we talked about in order to improve your art of prevention. This program is for informational purposes only and is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician with any questions you may have regarding a medical condition. Always consult with your physician before starting any exercises or doing anything contained in this program. Always stop if you experience any pain, discomfort, or difficulties performing anything described in this program.